Hello, I'm Veronica Emlyn. I'm the Patient Experience Facilitator and the Volunteer Service Manager. This is a really good opportunity to be able to say thank you to all our volunteers. Volunteers are an integral part of activities across the Trust that may be as a support to ward staff in the activities available to patients on the wards. It may be in an admin capacity with one of our community teams. It can be, we have two people who garden for us. One oversees the garden at the Heartlands and the other is gardens at one of our inpatient units off-site. Everybody does an amazing job and it's really appreciated. We also have service users and carers that specifically are part of our Service User Carer Council. They may take part in interview panels, part of document review policy groups, sit on an exec committee. The chair of the council actually sits on our trust board as a full member. They really do a lot of work in terms of service change and service user and carer experiences. And then we have service users and carers who also work as volunteer peer mentors. They may support a group, say on an inpatient unit of patients, so enabling those to share their views on the services that they're receiving, or in the community it's supporting somebody on a one-to-one basis so that they can enable and show about the pathway of recovery. In some instances, we have people who've gone on to get paid work, which is really excellent, either as peer support workers, as an activity worker, as somebody who's recently been employed actually as a nurse. So reasons for coming into volunteering is wide and varied. It can be specifically to build CV, experience, and then go on to get paid work. It may be to see whether actually a career in the NHS, and particularly mental health, is the way they want to go. It can be to put something back. We have service users who've been in our services and have really valued the work that has been done with them, and they want to put something back and also share that, again, that aspect that people can move forward and do move forward and can do other things. So real big thank you. We have had to stand our volunteers down because of COVID-19 this year. What's been really nice is so many people wanted to stay and do something, but it wasn't appropriate. But what we have been able to do once we'd established risk and all those factors was have some volunteers actually carrying out a different role, and that was in one instance, well, two instances, collecting prescriptions from prescribers and taking them to local chemists for people to pick them up from there. It was also someone was able to ring families to book their children in for their physical health checks, which freed up time for staff to get those clinics ready. And somebody else who supported the staff health and well-being, so actually coming in and help put boxes and various things together. What we also have, which is really lucky, I think, is that wide range of ages, genders, cultures and experience that everybody brings with them regardless. So it could be a student who's needing to build up experience for their course, and they have views and experiences that they can share. We have older people who retired, who again have their work experience and their life experience that they can share and enable. So we actually have a very rich vein of experiences from people and are really lucky to have them with us as volunteers. And I just want to again say